So this jaw and neck course is really about working with what's called the stomatognathik system. Stoma means mouth, gnathos means jaw. And the stomatognathik system consists of parts of the head, teeth, neck, and upper thorax concerned with the control of biting, chewing, swallowing, sucking, and speaking. The stomatognathik system is comprised of the occiput, the temporal bones, sphenoid, the maxilla, the mandible, the hyoid, the clavicles, the scapula, and the sternum, as well as the upper two ribs, the 7 cervical vertebrae, and the first 3 thoracic vertebrae, along with the muscles of mastication and muscles that are attached to the cranial base, to the cervical spine, the mandible, and the hyoid. The trigeminal nerve, or cranial nerve 5, is intimately related with the stomatognathik system. The cranial nerve 5 carries sensory input from the face, the greater part of the scalp, the teeth, the oral and nasal cavities, and its motor supply to the muscles of mastication and other facial muscles. The trigeminal nerve is 80% sensory, and it has 100 times more pain receptors, or nociceptors, than anywhere else in the body. And when this area is irritated, these nociceptors trigger the release of pain neurotransmitters, causing inflammation throughout the body. This is systemic inflammation. Chronic stimulation of this area, especially at the TMJ, temporomandibular joint, into the trigeminal nucleus, is linked to high sympathetic tone. What's high sympathetic tone? Fight, flight. So it's linked to high sympathetic tone in the body and the nervous system, and this lowers vagal tone, and that's the vagus nerve. There's a bidirectional connection between the trigeminal nerve and the vagus nerve. So when there's irritation at the trigeminal nerve, it can affect the whole body, partly through the vagus nerve, and vice versa. When there's imbalance, or when there was trauma involved, maybe the body is more in fight flight or in freeze, then that could reflect back to the jaw through the vagus and trigeminal nerve. So signs of stomatognathik imbalance in adults and children. A primary one that I work with a lot, and hopefully you will too, is TMJ dysfunction, or temporomandibular joint dysfunction. Also teeth grinding, mouth breathing, structural changes in the face and jaw, especially with children. It's easier to deal with. Constricted airway, headaches, neck, shoulder, back pain, facial pain, atrophy of the gums and of the teeth, grinding down of the teeth again, ringing in the ears or tinnitus, and obstructive sleep apnea. Temporomandibular joint dysfunction, or they use the abbreviation TMJD or TMD. It's a disorder commonly involving pain and dysfunction at the jaw and the muscles involved with jaw movement. common symptoms that you might find with temporomandibular joint dysfunction would include jaw pain, headaches, difficulties swallowing, dizziness, ear pain, tinnitus, neck, especially neck and upper back pain. So key factors for healthy jaw growth and straight teeth: genetics, breathing through the nose, the tongue and lip position, the body postural alignment, chewing hard foods, and stress resilience. Key factors for unhealthy jaw growth and crooked teeth. This would include food allergies and sensitivities causing mucus blocking the nasal passages, therefore breathing out of the mouth. Eating softer and pre-cut foods due to the introduction of tools in our human development and industrialization. Poor body posture alignment due to computer use or TVs, slouching, even overly supportive shoes. A decrease in resilience due to increased stress, environmental toxins, poor nutrition, and not having a non-optimal sleep environment, often too warm and dusty of a room and having a soft bed. Let's look at nasal versus mouth breathing. The sense of smell is tied directly to our limbic system and is an integral part of our survival mechanism. It's the only sense that's tied directly to our limbic system. Air is taken in through the nose and warmed, it's moistened, it's filtered, and a small amount of bacterial nitric oxide, which may play a structural role in maintaining lung health, are added to the air before it goes into the lungs. The breathing should always be inhaled through the nose with the mouth closed if possible. The mouth is not meant for breathing. The nose is. Mouth breathing can change the shape of a child's face and alter his or her appearance, resulting in a long, narrow face and mouth, less defined cheekbones, relatively small lower jaws, and weak chins that are set back. Mouth breathing can lead to periodontal disease, poor sleep, daytime tiredness, bad breath, dry lip and mouth, snoring, chronic sinus and ear infections, colds, swollen and red gums, and a smile that reveals a lot of gums and crooked teeth, gummy smiles. The alignment of the spine, pelvis, and feet strongly influence the proper growth and development of the cranium and should always be taken into consideration and corrected. Structure influences function. Okay, so when you're looking at working with people with TMJ problems, you want to look at the whole body and take all of that into consideration. Chewing hard foods from a very early age exerts great pressure throughout the cranium through the masseter muscles. The masseter muscles are the strongest muscles in the body relative to its weight. And this stress on the cranium and jaw stimulates stem cells, which are found within the cranial sutures, and this triggers growth of the mandible. This helps to form larger mandibles, allowing more space for the teeth to grow and a straighter occlusion. And when you look at humans developmentally, earlier on, we had much better teeth development, much straighter teeth, much more space between the teeth. You could see that even in Aboriginal society. Signs of an underdeveloped maxilla: high, thin, V-shaped palate, dental arch narrowing in children, can increase snoring and sleep apnea symptoms. Having a thin, long face from the front, lack of cheekbones, sunken mid-face or nose from a side profile, having droopy or uneven eyes. Could even have like darkness under the eyes, and crooked upper teeth. Signs of underdeveloped mandible include having a chin that's retruded, a rounded jawline, lack of forward growth of the upper and lower jaw. On side posture, the jawline swings down and back into the airway. Okay, so and this inhibits breathing and constricts the airway. Other signs of imbalance include tongue thrust when speaking, having a lisp or other speech impediment, having a tongue tie, which can prevent a child or adult from achieving a high tongue posture, tongue up on the palate, finding that the lips aren't together 100% of the time when there's no talking or eating, and also during sleeping, where the lips are not together and there's noisy breathing. Having a lower lip that's rolled forward, or even an upper lip that is sort of rolled up a bit and pulled in. That's called a Cupid's bow. Gasping for air, which is a sign of sleep apnea, and dysphagia, or incorrect swallow, and the most common form of this is a tongue thrust swallow. This is the end of this video. We're going to be moving on next to the corrective exercises portion in the next video, and then there are videos that follow after that I recommend looking at.